The American Diabetes Association. Public health problem. Problem exists in this society. In 2015, 30.3 million Americans, which is 9.4% of the population, had diabetes. From the 30.3, 23.1 were diagnosed and 7.2 went undiagnosed. 1.5 million Americans are diagnosed with diabetes every year. How does this happen? Type 1 occurs when the immune system attacks and destroys insulin and produces beta cells of the pancreas. Type 2 is the most common form, and this one is formed by several factors, including lifestyle and genes. Diabetes occurs when the pancreas, a gland behind the stomach, doesn't produce enough of the hormone insulin, or the body can't use the insulin properly. Where does this happen? Diabetes has been noted all over the world, in almost about every country. Diabetes prevalence has been rising more rapidly in middle and low income countries. What are the risks for the community in the future? It is said that by the year 2034, the number of diagnosed and undiagnosed will grow from 23.7 to 44.1. Diabetes population and costs are expected to double in the next 25 years. If no significant changes are made, it will add a significant strain to the healthcare system. Etiological factors. Family history is a big factor on being at risk of getting the disease. Middle-aged and older adults are the ones at most risk to develop this disease. 45 to 64 was the most diagnosed age group. African Americans, Mexican Americans, American Indians, Native Hawaiians, Pacific Islanders, and Asian Americans have a high risk for these deadly diseases. Whether you're a male or female also affects how likely you are to develop diabetes. Men are usually more likely to develop this disease. But once a woman reaches menopause, her risk for developing it goes up. How to solve the problem. Strategy 1. Advanced research. Doing research on both type 1 and type 2 diabetes to find possible cures and preventions. With the help of the research, they are able to develop medications that help diabetics to control and even prevent it. Strategy 2. Prevention. Making healthy eating habits, such as healthier options and portion control. Exercising also helps not only lose weight, but it also regulates blood glucose, blood pressure, cholesterol levels. Learning how to monitor and check blood sugar levels is also important as well. Cultural example. Nutrition in every culture varies, so it's important to ask patients about their specific food habits in order to have any hope of providing culturally appropriate advice for modifying traditional eating patterns to prevent and treat diabetes. 7.4% of non-Hispanic white, 8.0% of Asian Americans, 12.1% of Hispanics, 12.7% are non-Hispanic blacks, and 15.1% are American Indian and Alaskan natives. Historical example. The first known mention of diabetes symptoms was in 1552 BC, when Hassi Ra, an Egyptian physician, documented frequent urination as a symptom of a mysterious disease that also caused poor health. The estimated total cost of diagnosed diabetes in 2012 was $245 billion. pH in the future. What does literature say we should do? There should be some type of urgent help to this epidemic, being that this disease could actually lower the average life expectancy of Americans. 1 in 3 children born in America are expected to become diabetic in their lifetime. helping the ones that are already diagnosed with ways to control and live the healthiest life they possibly can. Also, keeping technology up to date as much as possible is important to allow them to discover new ways and inventions to help diabetes. My opinion. It is important that everyone knows the seriousness of this disease and to learn more about it. There are a lot of programs out there to help educate the people, taking into consideration the factors that could help prevent this disease. Everyone should think about their future and take the appropriate measures. Developing a way to distribute information and resources to everyone is important as well, despite their social class or financial situations.